is Common Ground, creating equity through public policy and community engagement.
Hello, everyone. I'm Lynn Vaughn. Welcome to another edition of Common Ground, Fulton County's creative and much celebrated answer to health disparities. Now, this model approach of integrated care service delivery is putting all public health services, that's health and employment and library and the arts, all in one location to address all of our constituents' needs, i.e., on common ground. In this show, we're focusing on the responsibilities of the Office of Emergency Preparedness. It's a division that falls under the Health Services umbrella. And while the name speaks for itself, there are many, many duties we want to make you aware of. With me today is the administrator of the Office of Emergency Preparedness, Mr. Al Wright. Mr. Wright, welcome to the show.
Well, thank you, and thank you for having me.
And I'm going to tell our viewers that if you look familiar, that's because he was all over local news earlier in the year when he graduated from Emory University with a master's degree, and his oldest son received an MBA, and his youngest son received an undergraduate degree. So congratulations to you and the boys.
Well, thank you.
Okay. Well, first of all, give us a general idea of what the county's responsibilities are with regard to these various emergencies that you handle.
Well, first of all, I'd like to thank you again for allowing me to come and talk a little bit about what we do in the Office of Emergency Preparedness. I'm here on behalf of our director, the health director, which is Dr. Patrice Harris. And the Office of Emergency Preparedness is essentially one of many offices. Here in the state of Georgia, we have 18 health districts. And each one of those health districts has an Office of Emergency Preparedness and Response, or Emergency Preparedness. And we're one of them, and we're actually the largest because, population, and because, we're here in Fulton County. So we have a very awesome responsibility. We're mandated, nationally mandated by the United States government that we have public health preparedness in all our communities that are served.
And is there a master plan? Do we follow a national guideline in terms of how it's planned, or is that something we're responsible for creating?
No, it starts at HHS, as the Health and Human Services, then filters down to the Centers for Disease Control and Prevention, and that's where we get our marching orders. And we were authorized to develop these organizations, and it kind of goes back to 9/11. After 9/11, we saw that there was a need, the government saw there was a need to further develop public health emergency preparedness at the local level.
Now, you were kind enough to send me over a list of some of the duties, and I'm going to go through them with you. One of them is to coordinate the public health response, that is emergency medical services with nursing homes and hospitals and those kinds of institutions in the event of an emergency. How does that happen?
Well, essentially, we develop plans. We develop plans that talk about different scenarios, whether it's a bioterrorism event. As I stated earlier, back in 2002, when there was the bioterrorism scare up in Washington, D.C.,
now that was with when you say bioterrorism, you're talking about the anthrax and the little powder that was coming through the mail.
The white powder. Okay. So that spurred the big push for the federal government to put funds into these organizations, and therefore here we are today because of that, basically.
Mm-hmm. So we have plans. If
Absolutely.
This were to happen in Atlanta, if someone were to, heaven forbid, begin to do the same kind of thing, that is send out dusts or whatever they find that they want to harm somebody with, we have plans in place to handle that.
Absolutely.
Okay. And the other category that I wanted to talk about is emergency drills, public health emergency response, and exercises. So you've got a plan to handle it, but then how do you put that into effect? You prepare for that, correct?
Absolutely. We're mandated to conduct periodic drills. These drills could be, bioterrorism related,
turn
or
this
they
over
could
to
be
groups of
pandemic
people who know each
influenza.
Okay, now
related.
let's pause there and tell our viewers what that is.
Well, pandemic influenza, if you remember, in 2009, we had the swine flu scare, in which we were trying to get our, governments and counties and all levels of government ready for the, possible impact of a pandemic influenza. And that means that we would have to dispense medications to ensure that all our citizens are protected. And so we were involved with those.
So the first thing you do in a situation like that, I remember that one very, very well. The first thing you would do would be to meet with the corresponding emergency preparedness personnel in other counties or in the metro area. How does that work?
Well, it is a joint effort, but each county, depending on where and how how bad the situation is, we work jointly with the other jurisdictions. We work very closely with our emergency management agency. We work closely with our hospitals and other healthcare facilities.
And then at what point do you think it's safe to bring the public in on it? Because clearly the public has to know what's going on and take certain precautions and behaviors.
Well, that's where what we call risk communications is involved, and that involves our own Fulton County Public Affairs Office or Public Information, which we rely on you guys to put the information out to the public and also to the medical community, as well as the media and our citizenry, so we can ensure that everybody is aware of what the dangers are and how to prepare and how it's impacting the community.
Now I'm just curious, last year, 2012, there was a very serious flu epidemic, so serious that Dr. Harris and Dr. McKenna felt the need to talk about it publicly and to call it to the public's attention. Did that rise to the level of a pandemic?
No, ma'am, not last year. It was headed in that direction, but it didn't get that bad. So, but as a precaution, they did have to put out information to the public to make sure people are aware of what was going on.
And this year we're just having a regular, normal flu season so far?
Thus far.
Okay.
Thus far, but you never know how things will change and what's going to happen on the other side of the world.
That's right, because a lot of these illnesses come through us internationally, is that right?
Absolutely. Well, as far as Atlanta as a major international airport, we have people who come here from all around the world. We also work with the Centers for Disease Control and Prevention. They have the quarantine stations that are, I guess you would say, the sentinels that would alert us to that. But also we have our epidemiology departments that assist us in doing the disease investigation and to ensure that we have timely information about the particular situation.
Well, all of that is good news, and it's a lot of hard work. We're going to talk more about that in a moment. But first, let's take a break. We will be back in just a moment with more on the Fulton County Office of Emergency Preparedness. We are back with Al Wright, Administrator of the Office of Emergency Preparedness. That is in Fulton County's Health Services Department. We talked a little bit about pandemic when we mentioned the 2009 H1N1 or swine flu epidemic. Pandemic planning requires you to establish a communications program and then talk to people about how to prevent it. And so going back to that event, how did we handle that?
Well, we put out information in regards to hand washing, sanitation, social distancing, and things like that to ensure.
Social distancing?
Yes, absolutely.
Which is?
In other words, if you feel ill or sick, don't come to work. Stay at home, take care of your family, and things like that. Mm-hmm. If they're say, for instance, you had essential services that are, or certain services that are non-essential. Those folks, if they're ill, they don't need to come to work. But on the other hand, if if you have essential services or personnel that needs to be there, ensure that you have backup persons to handle the situation or at the job site.
So Atlanta has been fortunate in the sense that we haven't really suffered another major health incident like that, but also the closest I can think of a mass casualty that might have a public health component was the Olympic Park bombing.
Right.
And so that was the two agencies coming together. Is that right? I mean, the civil part and the police and fire and first responder part, but also the health part. Let's talk about that a bit.
Well, in regards to the health department at that time, that was in 1996.
Right.
I was working with the Atlanta Fulton County Emergency Management Agency at the time, and I was on duty. We didn't see a public health problem at that time, but still public health was alerted to react if something else had occurred, because those explosions, you never know, there could have been some type of bioterrorism event, so we had to be ready.
So, okay, well, let's talk about the situation in Boston earlier this year. Had something like that occurred here? Is that something where we would have a public health response because of the number of people who needed to be treated?
Well, it was more of emergency medical services primarily. Public health is there to support. We're part of that support function. In the event that if we needed to coordinate certain activities with our emergency medical services as well as our hospitals, we would be standing ready to assist wherever we could.
Well, probably when people think of emergency preparedness, the first thing that comes to mind is natural disasters, hurricanes. We've even had earthquakes recently. Well, an earthquake recently, and I'm thinking about the tornadoes that tore through Atlanta a couple of years ago, and all of that was very unusual. Is there a role that Fulton County Emergency Preparedness has in those kinds of situations?
Well, looking at it from the public health aspect, say for instance, if we did have one of those traumatic incidences like a tornado or earthquake, well, our critical infrastructure would be severely damaged, and that's where there may be some public health implications, water, sanitation, those types of things like that, in which the health department would definitely be involved and be cognizant of, and try to at least lessen the impact of the situation.
But our other, you wanted to talk a little bit more about the other facet of it, not the health facet, but with Matt and the others who have responsibility for those?
Well, the Atlanta Fulton County Emergency Management Agency is the overall coordinating agency, for disasters and emergencies, in which you have key components from the various public safety, which includes fire, police, emergency medical services, as well as the hospitals. Everybody would convene in the Emergency Operations Center, as well as public health, to ensure that all services are covered and assisting where they can.
Can you recall an incident when that has happened, when everyone has had to come together like that?
Well, again, going back to 1996, we had the Emergency Operations Center activated at the time, and we had federal, state, and local agencies all convene in that location, as well as representation from the government, the mayor's office, county manager's office, and so on. All these folks were involved in monitoring the situation.
How do you make sure you guys are on the same page? Do you practice together? Because we can go a long time with nothing happening, and then all of a sudden a situation occurs and you have to respond immediately.
Well, that's where the planning comes involved, okay? Planning and exercising, getting to know your partners. So those are things that we have to do on a regular basis or a recurring basis to ensure that these plans are being exercised. We come up with different scenarios. There's always a what-if situation, so you have to develop those things, because then you have to update your plans, with your after-action plans and reviews. So to ensure that everybody is familiar with everyone.
And your role in public health would be to dispense medicine if such were the case. How do you do that? I'm looking here on my notes and you talk about pods.
Well, POD, or points of dispensing, in the event of a bioterrorism event, as well as an event of some infectious disease, we would set up points of dispensing. We have 3 strategic locations, north, central, and south Fulton County, in which we have those points of the dispensing centers in which we would have our nursing component, we would have volunteers, we'd have law enforcement, particularly for protection, to assist us in dispensing these medications to the citizenry. So those are the things that we have to do.
And all of that is somewhere on paper somewhere.
It's on paper.
In some great big vault somewhere,
Absolutely.
kept secretly, huh?
Absolutely, and we discuss it all the time. That's essentially one of our, I guess you would call it our bread and butter for emergency preparedness and public health.
Well, all right, I feel safer already just knowing that there is a plan and that you guys are on top of it all the time. We're going to take another break. So many areas to cover to make sure that county residents, in fact, all of us, are informed and prepared for all types of emergencies, particularly the ones we're discussing today, which are health emergencies. We'll have more on the Emergency Preparedness Office coming up. Hello again. This is Common Ground. I'm Lynn Vaughn, and with me is the administrator of the Office of Emergency Preparedness for Fulton County, and it's Al Wright. Thank you again for being here with us. Emergency drills, public health response, and so many things to do. I understand that you're able to get some of it done with the help of volunteers. What kinds of volunteer programs are there?
Okay, we have 2 different programs. We have the, first of all, the Medical Reserve Corps. Mm-hmm. And this is made up of ordinary citizens. There can be health professionals, as doctors, nurses, and other individuals to assist us, especially in if we have to implement and open up points of dispensing or the pods. It's definitely people-driven, need lots of people to assist us with registering folks, administering the medications, and various other jobs and duties. The Medical Reserve Corps, we're actively recruiting all the time. So we need citizens to come and at least contact us at my office and sign up for this organization. There are Medical Reserve Corps all over the nation. This is mandated by the Health and Human Services, and we have we try to work together with the other jurisdictions like DeKalb and Clayton County as well as Cobb County. Is there training that they have to undergo? Yes, we do provide training, and matter of fact, we're working on working together with the American Red Cross. We have a, partnership with them where they assist us in providing certain trainings and certifications for individuals that are interested in giving their time to assist us in emergencies. So. Now, time is such a big deal for everybody these days. How much time would it require of a volunteer? Not in an emergency, but for training and to just be on standby. Well, first of all, we have a database that we have their phone numbers and contact information. We try to do our training on a quarterly basis, have meetings and conduct training at the same time. So we try not to take up too much of their time, but when we do take up their time, we want to make sure that the time is meaningful, the purpose is meaningful, and so on, and that they have something that they can take away with them, and knowing that they're a part of a bigger picture or an organization as the Medical Reserve Corps. Do you have to have medical knowledge? No, there are various duties and responsibilities in the Medical Reserve Corps. We have as I stated earlier, we like to have nurses because we do have a need for nursing to assist. Medical doctors, if possible, we like to have them also, and as well as other citizens to commit their time to assist us.
But if I were going to register people, I wouldn't need to know much. I wouldn't need to have a medical
Not necessarily.
background.
Some clerical. There's all kind of duties and responsibilities in an emergency that we would need their assistance.
Okay, that's good to know. And then the second organization is CERT.
That is the Citizens Emergency Response Team. Now, they're located in various jurisdictions in Fulton County. Some of the fire departments have them, but I would, if anyone is interested in joining one of the CERT teams, they can contact the Atlanta Fulton County Emergency Management Agency at 404-612-5660 and ask to speak to someone about their interest in joining a CERT.
Okay. How do those duties differ from the MRC, the Medical Reserve Corps duties?
Well, they're similar in some ways, but again, our term is medical, because it's assisting us during those types of emergencies. But their assistance would be required, like say for instance, tornadoes or hurricanes or earthquakes or any of those other type of scenarios. That's where they would probably be needed.
More than
right.
Okay.
And some of their skills might be different. There's a few different skill sets that may be required.
Well, tell me what you would like for the residents of Fulton County to know about your office, the Office of Emergency Preparedness. What would you like the citizens to know?
Well, a lot of citizens really are not aware that so much planning is going on and the existence of a public health emergency preparedness office. And we just want to let you know that we're there, we're vigilant. We work with our other local response partners, the fire, police, emergency management agencies, and so on. So we just like to let you know that we're there, and we're there to assist and serve.
Well, thank you so much. I appreciate your time and appreciate all of the really good information that you have given us today. Thank you, Mr. Wright.
And thank you for having me.
And congratulations again on that master's degree.
Thank you.
We will have the contact information for you next. The contact information for the Office of Emergency Preparedness. We'll take another break. Be back in a moment. Welcome back. I'm Lynn Vaughn. I want to thank Al Wright, the administrator of the Fulton County Department of Health Services Office of Emergency Preparedness, for being with us. Thank you so much again. We appreciate it, and we're going to see if we can get some volunteers for those two organizations that would help out in emergencies.
Thank you.
Okay. And if you'd like to volunteer for the Medical Reserve Corps or the Community Emergency Response Team, that's CERT, go online to fultoncountygahealth.org, or you can call the Office of Emergency Preparedness at 404-613-1213. And there's also information for you at the Atlanta Fulton County Emergency Management Agency. That number is 404-612-5660. Thank you, as always, for your support of the county's Common Ground initiative. I'm Lynn Vaughn, your host of Common Ground. We'll see you next time right here on Common Ground.
This is Common Ground, creating equity through public policy and community engagement.